Hi, my name's Kristen Geiger.
Hi, I'm Taylor Litford.
And hi, I'm Tegan Altenberg.
Thank you. Judges, will you now please introduce yourselves using your name, degrees, and current positions?
Hi, my name is Carolina La Rosa Mateo. I have a master's in public health, and I'm the director of operations at a nonprofit called ASER.
Paul Gehring, a psychiatrist, retired and doing community mental health work.
My name is Kelly Webb. I have an MBA and an MHA, and I'm a consultant at Premier focusing on health equity.
Hi, I'm Mickey Scullard. I work at the Minnesota Department of Health and Emergency Preparedness and Response, and I have a DRPH and an MPH.
Thank you. Team, let me know when you're ready and I'll start the timer.
Hi, welcome to MN Farms. We are hired consultants that have been working with MN Farms for a year and a half now. At this point, we consider our own selves members of the farm itself and the community. We've been tasked with preparing our company for the predicted virus in April 2025. In this presentation, we will reflect on lessons learned from COVID-19, apply best practices, and implement new, innovative ideas.
Our root cause analysis revealed technical and adaptive challenges, with some being a combination of both. Technical challenges, or those with a more direct, simpler solution found at the farm, include a lack of language resources, poor training, high injury rates due to debilitating injury and carpal tunnel, and an approximate turnover rate of 40%. Adaptive challenges, on the other hand, are a little more complex. These involve multifactorial, systemic, and cultural issues. In solving these challenges, leaders must often seek many perspectives. Examples of these seen at the farm include widespread community mistrust, farm and healthcare misinformation, vaccine hesitancy, and cultural awareness. Now, combined challenges still require thoughtful, systemic approaches, even if they might not appear to. Examples of these include lower health literacy levels, confirmation bias, and language barriers. Throughout this presentation, we will present sustainable solutions to each of these challenges.
So our first action was to realign the mission and values of MN Farms. Our new core values will include integrity, collaboration, health equity, and innovation, and these will serve as guiding principles for our new mission, which states to protect families, protect the nation's food supply, and protect the long-term viability of our company.
Our second action is to learn employee feedback. Consider our valued employee, Isabel. She's a well-respected community member. In addition, her dad is a priest at the local bilingual church. When Isabel's injured on the job site, she reports her injury to management, who brush it off without providing care. She's unable to seek health care elsewhere due to time, language, and economic barriers. Isabel's preventable and treatable injury compounds in a carpal tunnel. As she loses feeling in her hand, she loses trust in the management and healthcare system. This feeling of mistrust intensifies and leads her to seek unreliable information and feel vaccine hesitancy. We learned it's important to understand our employees' lived experience. It's important to operate with increased cultural awareness to address employee concerns regarding injury prevention and pandemic preparedness response.
Here's how we're going to prepare our facility. First, we're going to develop multiple interprofessional teams to help us problem solve our major concerns. Second, we plan on hiring an on-site, culturally informed healthcare team to rebuild our relationships with our employees. Third, we're going to have a pandemic preparedness team to help with the future pandemics. Fourth, we value our workers and our families, so we want to provide resources for them during this future pandemic. Fifth, we plan on acquiring new equipment and examining our policies and procedures to help us minimize our injury rates and our turnover rates. And finally, we're going to increase our community interaction to help us to grow trust beyond our workforce.
So these goals will be achieved by creating 4 interprofessional teams. These teams will include the Pandemic Preparedness Team, the Injury Prevention Task Force, the Communications Committee, and the Minnesota Turkey Coalition. A 20-month plan with supporting evidence for each of these teams can be found on page 1 of your appendix. Members of each of these 4 interprofessional teams may include some or all of the following. So first, we will include facility members like Isabel, who can contribute employee perspectives to our new initiatives. Then we will also include our on-site health team so they can help build trusting relationships with our employees and all of these other team members. Third, we will have community gatekeepers such as Hispanic influencers, faith-based leaders, and promotoras, which are community health workers. Then we will also work with the media to help release news to the public about all of these new initiatives that we are implementing and help create trust. Next, we will work with local public health officials from Hutchinson Health Clinic, McLeod County Public Health, and the Minnesota Health Department so they can have an input on everything we're doing and we can understand what they're doing as well. And then finally, we're going to partner with other Minnesota turkey farms to help build a trusting relationship between the public and the poultry industry.
These interprofessional teams are tasked with developing connections with multiple stakeholders. First, we want our employees to feel valued and make them an integral part of the company decision-making process. Next, by valuing employees and their families, we will gain community trust. Third, partnerships with local public health and media experts will work to decrease misinformation, mistrust by creating a unified communication plan. And finally, with satisfied employees, healthy community, and improved communication, this will enhance our relationships with customers and suppliers. Our slide here displays how interprofessional teams will engage with stakeholders. As you can see, our Injury Prevention Task Force is an internal program. Our other interprofessional teams will engage with everyone: employees, family, community, and the general public.
So each team will have specific tasks that they are working to complete. First, our pandemic preparedness team will be working to reduce misinformation, mistrust, and vaccine hesitancy in partnership with those community leaders and healthcare partners. Their first action will be to implement no-touch equipment throughout our farm in restrooms, clock-in stations, and frequently used doors to help reduce transmission. Second, PPE will be stockpiled and paired with improved training and policies regarding PPE. Third, we will redraft or create new human resource policies that will include paid leave policy during the pandemic, staggered employee clock-ins with temperature checks, on-site isolation and quarantine options, sanitation schedules, and social distancing practices. And then finally, and most importantly, we plan to offer on-site resources for all of our employees and their family members. First, we will have a healthcare hotline that begins in April of 2025. It can be called or messaged 24/7 during those pandemic months. Then we will also have internal website links where they can have links to local resources and reliable information. And then once the virus presents a direct threat to MN farms, we will begin on-site testing clinics along with vaccination clinics once that becomes available. And these will all be available to employees and families without proof of identification.
Our Injury Prevention Task Force is dedicated to improving workplace safety and hiring our on-site health team. First, multilingual employee training will be available utilizing AI translation, with the task force members then proofreading these documents. They'll then be available on interactive tablets that will be strategically located around the facility. Second, our task force will install new equipment intended to decrease injuries such as anti-fatigue mats, lean bars, or cutout workstations. Third, we plan on implementing recommendations for a job rotation schedule to help us to prevent repetitive injuries. We're also going to invite OSHA experts to review our procedures and policies and make any additional safety recommendations they think we need. These three actions help us to demonstrate value for our employees and build trust. The most critical action of the Injury Prevention Task Force is to build our healthcare team. This team includes an occupational health nurse practitioner, a clinic manager, an occupational therapist, an occupational therapy assistant, and a certified medical interpreter. The healthcare team will complete regular rounding throughout the farm, and they'll be able to educate employees about how to prevent musculoskeletal injuries. They're also going to be able to rehabilitate injured employees, such as Isabel's carpal tunnel. Employees will see the nurse practitioner and occupational therapist about once every 3 months for a regular checkup. This will help us to build trust and reduce stigma and fear surrounding healthcare. Eventually, this group will be present at our vaccine clinics as trusted healthcare personnel.
Our Communications Committee is charged with engaging staff and the community. We will connect with the Hispanic grocery stores, local promotoras, and community stakeholders to identify misalignment between beliefs and practices. This group will also conduct employee surveys and focus groups to identify direct employee concerns. In addition, this team will establish our turkey well-being live stream. This will show the public the animal and farm safety procedures completed. Finally, we will launch our vaccine hesitancy campaign to reduce misinformation and health disparities. This next slide shows the first action of our vaccine hesitancy campaign. This is a social media post that will work on the social norming for a vaccine pledge, which will be posted on our social media. In addition, we will have a vaccine tracker to share the percentage of employees vaccinated. Finally, our website can be seen here. This site will share our turkey live stream, links to community partners, and social media accounts. In addition, there will be an internal employee resource that will include our healthcare hotline, testing signups, and more.
So finally, we will have the creation of the Minnesota Turkey Coalition between MN Farms and other Minnesota turkey farms. Their goal is going to be to reduce misinformation and create a trusting relationship between the public and the poultry industry. First, they're going to begin by surveying the public to determine what common concerns arise when citizens are considering the poultry industry. They will then begin addressing these concerns through social media posts released by each individual farm, bilingual newsletters that will be placed in community hubs, media releases through those media personnel partners, and virtual town halls that will begin with the virus in April of 2025. Each farm will also be tasked with sponsoring a biannual health initiative within their own local communities. These will help to increase community engagement and address health inequities within those communities. At these events, they will also work to dispel any misinformation there is about the zoonotic transmission of this virus, and this will also be done through radio stations, TV channels, social media influencers, and local community bulletin boards.
We estimate that the preparation and response will cost around $500,000. Most of the budget is designated for our healthcare personnel, but other items include our turkey cameras, interactive tablets, no-touch equipment, and PPE. A line item budget can be found on page 5 of your appendix. Funding will be secured through the Meat and Poultry Processing Expansion Program that has a minimum reward of $250,000 with a maximum of $10 million. Funds will be primarily used for the healthcare personnel and our pandemic supplies. The Meat and Poultry Inspection Readiness Grant will be secured to provide workplace improvements, and the U.S. Department of Agriculture funds can be used for our additional project expenditures. Contingency funding will be available by decreasing our profit margins by 1% to help cover any unexpected expenses.
As you can see, there are multiple measures of success. These can also be identified in our appendix looking at specific objectives, but here's to highlight a few. Our Injury Prevention Task Force will monitor injuries, sick leave, and turnovers. Our goal is by November 2025, MN Farms will reduce occupational injury rates by 50% through implementation of increased safety measures, advanced equipment, and data collection from the healthcare team. Our pandemic preparedness team will track the following progress targets, looking at calls and texts on that healthcare hotline. In addition, they will also monitor attitudinal and behavioral targets, looking at intentions to be vaccinated and actual vaccination rates. Another goal, beginning in April 2025, 80% of MN Farm employees will receive a test within 24 hours of the symptom onset. Next is our communications team. The communications team will monitor consumer interactions with the live stream, website, and social media. They will also be in charge of our employee satisfaction surveys. MN Farms aims to increase our employee satisfaction by 5% through focus groups and surveys. Finally, our coalition. Our Turkey Coalition will monitor public trust through public surveys and consumer patterns. Our goal is by December 2025, MN Farms will increase virtual town hall attendance by 30% to measure community engagement between the farm, employees, and the public.
So as you can tell by our different funding initiatives and our measures of success, we are committed to the sustainment of this improvement plan. However, we also want to discuss the sustainability of some of our initiatives we're implementing at the farm. So here's 2 examples. First, we plan to reduce employee turnover by our goal of 65%. And if we can achieve this, we will retain 20 employees and save over $1 million each year. Second, if we can decrease our injury rate by our goal of 50%, we can save around $160 each year on injury-related costs. Other money-saving initiatives will include greater productivity, increased employee satisfaction, and overall market growth through that increased community awareness.
To ensure continuous growth, we also wanted to include our thoughts for the future. Our goals include continuing our data-driven decision-making to improve sustainability, employee satisfaction, and the farm's integrity. By August of 2026, MN Farms will secure 3 new community partners to increase trust and equity between the farm and the community. By November of 2027, we will employ another provider and 2 part-time mental health providers to improve employee well-being.
Let's go back to Isabel for a moment. After the health team was hired, she was able to receive the necessary rehabilitative care to address her carpal tunnel. This positive experience with the healthcare team created trust and gave her a safe space to learn about the pandemic. This led for her joining the pandemic preparedness team and becoming a vaccination ambassador. As a well-respected community member and bilingual employee, she encouraged others to receive their vaccine and take proper care of themselves and their family. Isabel's family were also regular users of our healthcare hotline. In addition, her dad, the local priest, kept members of their church informed by diffusing additional information from the coalition newsletters and links on the internal website. So, with all this in mind, are you ready to protect our families, our nation's food supply, and the long-term viability of MN Farms? Thank you.